And so talk about the impact of nutrition specifically on cancer. What is cancer and what does nutrition have to do with cancer?
This is not just hearsay and innuendo, but essentially there's 5 main reasons why all cancer patients need to use nutrition as part of their comprehensive cancer treatment. And a forewarning, I would not use nutrition as sole therapy against cancer. It's insufficient, but it is irreplaceable. And so given that, let's just think of the 5 main reasons why every cancer patient needs to include nutrition as part of their comprehensive therapy. Number 1, nutrition actually is a big part of the malnutrition. 40% of cancer patients die of malnutrition, not of the cancer. Cancer is a wasting disease. Appetite is affected. You end up in the hospital with food that you're unfamiliar with. Chemo and radiation can induce cachexia or lean tissue loss. So malnutrition kills 40% of cancer patients. The only therapy for that is proper nutrition. It sometimes needs to be aggressive with a metabolic support team such as total parenteral nutrition and other things.
Patrick Quillen, who wrote Beating Cancer with Nutrition, a very good friend of mine, in his book says that 42 to 46% of cancer patients die of cachexia, of malnutrition. How many oncologists are addressing malnutrition? No one. In fact, what do? They give people Ensure, which is sugar, and you know that cancer is an obligate glucose metabolizer. It needs sugar to survive. In fact, one of the techniques is to reduce the amount of sugar so that it can't feed the cancer. But they're actually giving gasoline to the fire and then expecting to put out the fire. You can't put out a fire with gasoline.
Dr. Samuel Hahnemann, who was a physician in his day in the late 18th and early 19th century, determined that the medicine that he was giving his patients was more harmful than the disease. And he couldn't stomach that, and that's where he was motivated to develop a system that became a broad-based worldwide system called homeopathy, utilizing small quantities or amounts of naturally occurring substances from the mineral, animal, and plant kingdoms. And in this way, there was a growth around the world out of Germany of this new form of medicine.
Now, first of all, the patients do not die of cancer. Seldom do they die of cancer. They die of complications from cancer treatment. Okay, that's just what happens. I was told by Dr. Scott Hainan that about a study he's sending me here recently that there's a study out that says that if you're on 5 or more medications, it is impossible to predict the clinical response of the 5 drugs. Okay, so that's why it's all a guessing game. They will give a drug for this and a drug for that, and then you end up giving drugs for the symptoms caused by drugs. And it's an awful spiral. Now, there's a place for some drugs sometime, but I generally think of them as a Band-Aid to get people over a hump before they can figure out how to get their body responding like it's supposed to.
So this explains why doctors now use drugs as a Band-Aid, as Casey just said, instead of getting to the root cause of disease.